A resident with Parkinson's disease has difficulty initiating movement. What is the aide's best approach when assisting with ambulation? A. Encourage the resident to walk faster. B. Use gentle cues and allow extra time. C. Pull the resident forward firmly. D. Avoid walking with the resident. Answer: B. Parkinson's residents often need extra time and gentle prompting. Rushing increases fall risk. Which is the safest method to identify a resident before giving care? A. Ask the resident's roommate. B. Check the care plan only. C. Use two identifiers, such as name and wristband. D. Ask a visitor in the room. Answer: C. Using two identifiers ensures correct resident care and prevents errors. A resident is on fluid restriction. The aide should: A. Offer large amounts of water at once. B. Provide fluids only when thirsty. C. Record and strictly monitor fluid intake. D. Refuse all fluids completely. Answer: C. Accurate monitoring of fluids prevents complications like fluid overload. Which step reduces infection when removing contaminated gloves? A. Pull both gloves off at once. B. Touch the outside surface directly. C. Remove one glove at a time without skin contact. D. Wash gloves before removing. Answer: C. Removing gloves without touching the outside surface reduces contamination. A resident with dementia tries to leave the facility, believing they need to go home. The aide should first: A. Call security immediately. B. Argue with the resident about their location. C. Redirect the resident calmly to a safe activity. D. Lock the resident in their room. Answer: C. Gentle redirection avoids confrontation and maintains safety. When positioning a resident in Fowler's position, the head of the bed should be elevated. A. 15 to 30 degrees. B. 45 to 60 degrees. C. Flat with no elevation. D. 75 to 90 degrees. Answer: B. Fowler's position is typically 45 to 60 degrees, promoting breathing and comfort. Which observation must be reported immediately to the nurse? A. Resident ate all of breakfast. B. Resident is refusing to attend activities. C. Resident has new difficulty breathing. D. Resident requested a blanket. Answer: C. Breathing difficulty signals potential emergency and requires urgent reporting. When transferring a resident using a gait belt, the aide should: A. Place the belt over bare skin. B. Secure the belt snug but comfortable. C. Pull the belt only from the back. D. Never use the belt on frail residents. Answer: B. The belt must be secure yet comfortable to assist safely with transfers. Proper hand washing requires scrubbing hands for at least: A. 5 seconds. B. 10 seconds. C. 20 seconds. D. 40 seconds. Answer: C. Scrubbing for 20 seconds is recommended to remove pathogens effectively. When documenting care, which practice is correct? A. Record care before performing it. B. Leave blanks for others to complete. C. Document immediately after providing care. D. Use correction fluid for mistakes. Answer: C. Documentation must be timely, accurate, and reflect actual care given. Which item is considered personal protective equipment, PP? A. Wristwatch. B. Face mask. C. Clipboard. D. ID badge. Answer: B. Masks, gloves, gowns, and eye protection are examples of PPE. If a resident begins choking and cannot cough or speak, the aide should A. Perform abdominal thrusts. B. Offer water. C. Pat the resident's back. D. Leave the resident to get help. Answer A. Abdominal thrusts remove the airway obstruction when the resident cannot breathe. A resident with a urinary catheter complains of pain. What should the aide do first? A. Pull the catheter out. B. Check for kinks and report to the nurse. C. Ignore since discomfort is normal. D. Increase fluid intake immediately. Answer B. Checking for kinks ensures drainage. Any pain must be reported. Which skill protects a resident's dignity during bathing? A. Closing doors and curtains. B. Bathing all residents in the same order. C. Speaking loudly about their condition. D. Skipping privacy to save time. Answer A. Privacy maintains dignity and respect during personal care. The aide finds a resident on the floor. What is the first action? A. Help them back to bed quickly. B. Assess for injuries and call the nurse. C. Ask them to stand up immediately. D. Leave them to get a wheelchair. Answer B. Residents must be checked for injuries before moving. Nurse must be notified. When feeding a resident with swallowing difficulties, the aide should A. Offer large bites. B. Position resident upright at 90 degrees. C. Use a straw for liquids. D. Feed quickly to finish meals. Answer B. Upright positioning reduces risk of choking and aspiration. Which of the following is a sign of hypoglycemia? A. Flushed skin and headache. B. Tremors and sweating. C. Slow pulse and confusion. D. Warm dry skin. Answer B. Low blood sugar often causes sweating, shakiness, and irritability. A resident reports feeling sad and withdrawn. The aide should A. Tell them to cheer up. B. Ignore the comment. C. Report mood change to the nurse. D. Force them to join activities. Answer C. Emotional changes may indicate depression and must be reported. Which body part is at greatest risk for pressure ulcers in bed? A. Elbows. B. Sacrum. C. Hands. D. Forearms. Answer B. The sacrum is a common site due to prolonged pressure when lying down. What is the correct action if a resident's dentures break? A. Attempt to repair them with glue. B. Document and report to the nurse. C. Discard them immediately. D. Let the resident continue using them. Answer B. Denture issues must be reported. Never attempt repairs independently. When collecting a urine specimen, the aide must ensure A. Gloves are not needed. B. Container is labeled correctly. C. Specimen is stored in resident's drawer. D. Any container can be used. Answer B. Correct labeling ensures accurate lab results and prevents mix-ups. A resident with a hearing aid cannot hear well. The aide should first A. Check if the hearing aid is turned on. B. Speak louder. C. Replace the hearing aid immediately. D. Call maintenance. Answer A. Always check power, placement, and battery before further action. Which is a safe practice when assisting with oxygen therapy? A. Adjust oxygen flow rate as needed. B. Keep oxygen away from heat and flames. C. Allow resident to remove tubing freely. D. Store oxygen tanks in bed. Answer B. Oxygen supports combustion, so it must be kept away from flames or heat. What is the aide's role during a fire drill? A. Run outside immediately. B. Ensure resident safety and follow facility protocol. C. Hide until drill ends. D. Continue routine work without interruption. Answer B. Aides must follow fire safety procedures to protect residents. Which of the following should be reported immediately after giving a resident medication, if allowed under facility policy? A. Resident takes medication calmly. B. Resident refuses medication. C. Resident swallows with water. D. Resident asks about side effects. Answer B. Refusal must always be reported so nurse can decide next steps. A resident with Alzheimer's is becoming agitated during evening care. The aide should A. Use calm voice and reassure. B. Force care quickly to finish. C. Leave without providing care. D. Argue with the resident. Answer A. Calm reassurance reduces agitation and maintains trust. Which is the correct way to prevent the spread of infection? A. Wash hands only if visibly soiled. B. Wear gloves for all contact with body fluids. C. Share grooming items among residents. D. Skip gloves to save supplies. Answer B. Gloves are essential for infection prevention when dealing with fluids. A resident suddenly complains of chest pain. The aide should A. Give them food. B. Report to nurse immediately. C. Walk them outside. D. Tell them to lie quietly until it passes. Answer B. Chest pain may signal heart attack. Nurse must be notified urgently. When assisting a resident with limited vision, the aide should A. Move quickly ahead without warning. B. Explain actions before touching. C. Avoid talking during care. D. Assume the resident understands automatically. Answer B. Explaining actions helps reduce fear and maintains dignity. A resident is placed in restraints by nurse order. The aide must A. Leave restraints on at all times. B. Check circulation and comfort frequently. C. Apply restraints without checking order. D. Ignore resident complaints about restraints. Answer B. Monitoring ensures safety and prevents injury from restraints. A resident on a pureed diet requests a regular sandwich. The aide should A. Provide it immediately. B. Politely explain diet restrictions and inform nurse. C. Remove all food from tray. D. Hide the sandwich from sight. Answer B. Dietary restrictions are medical orders, aide explains and reports. Which is the best action to prevent falls during toileting? A. Leave resident alone. B. Keep call light within reach. C. Dim all lights. D. Encourage rushing to finish quickly. Answer B. Call light access allows residents to request help, reducing fall risk. A resident asks the aide to keep personal health information private. This is protected under A. OBRA. B. HIPAA. C. OSHA. D. CDC. Answer B. HIPAA protects residents' personal and medical information. When measuring blood pressure, the cuff should be placed A. Over clothing. B. 1 inch above the elbow crease. C. On the wrist always. D. Below the elbow. Answer B. Correct placement ensures accurate blood pressure readings. Which is the aide's responsibility during postmortem care? A. Perform autopsy. B. Clean body and maintain dignity. C. Notify coroner directly. D. Write death certificate. Answer B. Postmortem care focuses on respect, cleanliness, and dignity. A resident has a new skin tear. The aide should A. Apply tape directly over wound. B. Cover lightly and report. C. Ignore since minor. D. Scrub area with alcohol. Answer B. Covering reduces infection risk. Nurse must assess. Which task is outside the nurse aide's scope of practice? A. Assisting with bathing. B. Giving injections. C. Taking vital signs. D. Assisting with feeding. Answer B. Injections are outside STNA scope and require licensed nurse. If a resident complains of dizziness after standing, the aide should A. Quickly walk them down the hall. B. Sit them down safely and report. C. Ignore since it will pass. D. Give them water immediately. Answer B. Sitting prevents falls, and nurse must be notified of symptoms. The most important reason to turn and reposition residents regularly is to A. Keep them comfortable. B. Prevent pressure ulcers. C. Save time during care. D. Avoid boredom. Answer B. Regular repositioning reduces prolonged pressure, preventing ulcers. Which statement best reflects the aide's responsibility in resident rights? A. Aides decide what rights residents have. B. Residents lose rights in long-term care. C. Residents retain all basic rights and dignity. D. Rights apply only during visiting hours. Answer C. Residents in care facilities maintain all rights to dignity, respect, and autonomy.